Hi, my name is Rebecca Asbell. I am a dermatology nurse. I've been working in this clinic with Dr. Wassel for about 9 years, and I predominantly work with patients on research trials, but our specialty in this clinic is psoriasis, and so the majority of the patients I see suffer from psoriasis. When I see patients for the first time and they know this information, I see a lot of different emotions in them. I can see some fear, some anxiety, sadness. They're usually quite depressed. They often do not make eye contact with me because they don't want to be looked at. We see a lot of young males with hats on trying to really cover themselves up. We see women who tell us stories, young women who tell us stories about fear of intimacy and being close to people. So we really get a whole lot of emotions in our office. We get some tears, we get a lot of stories that are quite horrible. We hear about people being kicked out of public swimming pools and things like that because of their psoriasis, and it's very hard to listen to. But we get all sorts of emotions here in this office. That can be tricky depending on their emotional state. We do try to reassure the patients that are here that we've been working with psoriasis patients both in clinical trials and through our clinic. And we have a lot of experience with psoriasis patients. We do let them know that we will continue to work with them. The first thing we try may not be the right solution for that person, but if they stick with us, we'll stick with them until we can find the right combination of treatments for them. And usually that will help to reduce some anxiety and fear, and they can usually open up and allow us to help them. They usually have a lot of questions, and we will try and answer their questions as thoroughly as we can. We do have a lot of resources that we can give them, and I've brought a few just to show. So there are 2 books written by some wonderful dermatologists in Canada. This one is written by Dr. Papp from Waterloo, and we have this book written by Dr. Langley from Nova Scotia. And they are written for the layperson to understand, nice and simple English, and with a lot of information about the disease and about the treatments that are out there. And people find that really helpful. There are also some other resources such as this, put out by the Canadian Skin Patient Alliance. A lot of people really like using the internet and will ask questions about information from the internet. So I will try and steer them to reliable sources such as the Canadian Skin Patient Alliance or the National Psoriasis Foundation, and hope that they can use links from there to get good information rather than some information that they could find while surfing the internet. We do get patients that read stuff that's scary, so we try and give them the facts and redirect them to better sites and give them the truth. And even if there are facts that might seem scary, we'll try and put it into perspective that will make it a lot less intimidating for them.